Well, can I say happy April 1st to everyone? What's going on, family? Yep, y'all just come on in the room. Y'all know, let Bella do what I do. Well, good evening to my Twitter family. Hello, Facebook. Hello, my newbie family, LinkedIn. Thank you so much for joining. And above all, I can't forget my main tribe. What's going on, YouTube family? How y'all doing tonight? Well, I want to say April Fool's Day. It's April 1st, and I hope all is well. As y'all can hear, Bella, my voice is kind of going in and out. So, y'all know what that means. I've been talking too much, right? But I got a treat tonight. Y'all know I've been ready. It's Friday. Happy April 1st. Thank you all so much for tuning in. We counted on joy. Trust and believe. I know you could be anywhere, doing anything at any time, but you chose to be loyal and follow Bella. So thank you. And I will not, let me repeat that, will not do anything but have excellent, okay? So we're in the April 1st, and tonight we have the Ask Dr. P, Ask the Doctor. And y'all know I do what I do, right? So if y'all look down the square below me, we got the infamous Dr. Paul Alfonso, right? And so I don't know for those people, y'all know I put my stuff up early. So I hope some of y'all went out there and did a little read on him, did a little Google that, right? Because I want my educated audience to be just that educated. I'm gonna talk a little bit about him, but y'all know I do what I do. This is X Dr. P. So Dr. P will be doing the hosting tonight. But for right now, let me just brag a little bit because I'll never have these credentials. Y'all know Bella, right? But here I go. So Dr. Paul Alfonso is a well-renowned urologist, and he works out of the WellStar family. Now that's WellStar healthcare system for those in Georgia. I'm not slighting my California, my DMV, and all over the world. And I got my Tanzania family on here, Dr. Priscilla. Wow. Listen, y'all know that I live in Atlanta, but I am worldwide. Y'all know that I got the worldwide trade, right? We'll talk about that another episode. However, I am proud to present Dr. Paul Alfonso. He speaks several languages, multiple to be exact, Haitian Creole, English, of course, and Spanish. He has several degrees. He has a doctorate of medicine degree from the University of Florida College of Medicine. He did his residency at Baylor College of Medicine and his fellowship at Midtown Urology. But y'all know me, I get all them words mixed up because y'all know that ain't my forte. So what I'm going to do is go ahead and bring on Dr. Priscilla. And wait a minute, we might have a few new audience. So Dr. Priscilla, let me kind of bring them in the fold. Everybody I can't assume watches and follows me all the time. So Dr. Priscilla Hubbard, that's what I said, doctor. She's not a medical doctor, but she's going to tell you a little bit about herself. So Dr. Priscilla, without further ado, take it away.
Good evening, everyone. And thank you, Bella, for this opportunity to be here with you again. I love being on the show and love to bring you the opportunity of the exposure that I have with some phenomenal physicians. And I'm very honored to have one of these physicians with us this evening, Dr. Paul Alphonse. And you gave him a brief introduction, but Dr. Alphonse is also a member and current past president of the Atlanta Medical Association, which is one of the oldest African American associations here, which we started back in 1890 with the opportunity for those physicians who were not able to practice medicine. They were started this organization, which through that derived the Georgia State Medical Association, as well as our National Medical Association, which is our corporate offices, which are located in Washington, D.C. But Dr. Paul Alphonse, I have come to know him over several years, almost 12 years now, as I am currently the executive director and also the chief operating officer for the Atlanta Medical Association and the Heritage Fund here in Atlanta, where we raise scholarship funds for medical students at the prestigious medical schools of Morehouse School of Medicine, Howard University College of Medicine, and Meharry College of Medicine. So I am very honored to have Dr. Alphonse here this evening. He is a renowned urologist, actually stated earlier, with WellStar. And he's not only a urologist, he is a physician, but he's also, I consider him a very, very good friend. And I can call upon him for anything. He and his beautiful wife, his two sons, honored to have him on the show, and he's going to be able to give us some wealth of information that is going to help us in our community, hopefully help the listeners. And we want you to be able to ask those questions that have been burning inside. what a urologist is, what does a urologist do, all the things related to that. And Dr. Paul Alphonse is going to be here to be able to address those questions. So drop those questions in the chat and get back with us, and so we can answer those questions for you. So right now, with no further ado, I am going to turn over this to my wonderful friend, Dr. Paul Alphonse.
Good evening, good evening, good evening, everyone. And to all the family in Atlanta, to all the family across the Southeast, all the family across the United States. And Lord have mercy, we got folks in Tanzania and I'm sure South America, Europe, all worldwide. This is information that's important. This is information that's important to our community. And as a urologist, I deal with sensitive information all the time. But I definitely want to make sure that this is information that each one can teach one and pass it on to the next, because with knowledge is power.
Yes,
But I
right.
have to do a little house cleaning this afternoon, excuse me. Of course, I am a urologist at WellStar Systems, so the information that I give is directly of my own and not of WellStar Systems. So I want to make sure that I put that out there early. And so, of course, this is information coming directly from me and not of the health system that I work with. So without any further ado, hopefully everyone will drop their questions in there, but definitely want to make sure that you guys understand a little bit of what I do. As a urologist, I am what one would consider be the female equivalent of what a GYN is to a female. That is what I am to a male. So all the things that pertain mostly below the belt, that is what I take care of. And when I say that, people, the light comes on. They're like, oh, okay, I understand. I understand. And so anything that deals with the kidney, the ureter, the bladder, prostate, the testicular issues, the penile issues, and of course that segues into a lot of the female problems. We do have stress urinary incontinence and leaking issues and things of that nature, erectile dysfunction, testosterone supplementation, premature ejaculation, a lot of the stuff that goes down in there, and prostate cancer, kidney cancer, bladder cancer. So there's kind of a wide swath, if you will, of issues that I take care of as a urologist. And it is never a dull moment, if you will, in the urologist's office, because yet at the same time, we can take care of things that are very, very serious. But Lord have mercy, do I have some stories too? And so we're going to keep things as serious as possible, because definitely these are things that definitely we want to bring home to the public. But obviously, as questions comes in, please make sure you bring them abreast, and we will address them as they go.
So thank you, Dr. Alphonse, giving us a brief overview of what you do, and you do this every day. And my thing is, when should a person come to see you as a urologist? What kind of symptoms that may arise that they might need to come to see you, male
Sure,
or female?
sure. So great question. And I'll be candid, we get two populations of people. You get people who come to see a urologist kicking and screaming because they are really embarrassed, because they don't want people to know that, they're let's just say their engine is not working like it should. And these are people who have had a number of issues that's been going on for years. And unfortunately, it might take uh, losing a significant other, whether it's a girlfriend, a wife, or something like that. And if things are not working down there, then that's what prompts them to be able to come see a urologist. So it is quite important for a man to see a urologist. Obviously, if things aren't going well, to take care of erectile dysfunction issues or take care of libido issues. But then there's the other segue of people who don't have any issues whatsoever. But if you have a family history of prostate cancer, and that is very important, especially in our community, where men, Black male who are age 40 and above, if you have a family history of prostate cancer, we tell them on your 40th birthday, before you blow out that candle, you're coming into my office that morning, and you and I are having a very close, intimate conversation and a close, intimate physical exam to ensure that things are well with the prostate, because we know that that is something that has gone on unattended to for quite some time, and it has ravaged our community. But as the information is getting out there, and as social media and forums like this, and I want to thank you, Miss Bella and Priscilla, for allowing this venue. But as information is getting out there, men, not just Black men, but men in general, are understanding that as you get past age 40 years old and above, it is important on a yearly basis to come and get your prostate examined to ensure that things are where they need to be.
So, Dr. Fons, I know you talked about individuals may have a problem with their libido. I know, especially when you get to a certain age. So, how do you help those who might have some hesitancy to come to you to have that, type of delicate conversation?
Sure. Well, I'll tell you how it happens in my office. It's my medical assistant. She's phenomenal. Mimi, I'll go ahead and put her name on there. Shout out to Mimi. She's my right hand and left hand. She helps me do what I do. And she'll say, with a patient comes in, she'll say, Dr. Alphonse, we have a young 40-year-old gentleman who's coming in, and he just wants to get a physical exam, a prostate exam. And I'll say, is he having urination issue? No. Is he having any frequency issue? No. She said he just wants to get a prostate check. So a prostate check is a really, really good code word, if you will, that allows a lot of men to be able to come in under the cloak, if you will, of just a routine physical exam. But actually, when you walk into the door, it quickly segues into, Doc, well, in addition to me wanting to get my prostate checked, I really want to talk to you about this problem where, I can't get things to work right, or I'm not lasting as long as I want to, or the missus is saying that I'm having some challenges, keeping up to where I used to be. And so it is very simple and straightforward when you reach out to either your primary care physician, and whether it's a male or a female primary care physician, if you don't feel comfortable having that conversation, is you say, hey, can you send me to a urologist where I might be able to, talk about some man issues or a prostate check. That usually allows you to be able to come in, and then we kind of take the baton and we take it from there.
But why is it when I got some relatives I've been begging and for, look, please go get it checked. Well, why is it they're so men are so resistant? Is it because it's the delicate procedure in order to get that done? Is the reasons why?
So I think there is a lot to be said for who we are as men. We are seen to be the providers, the protectors. We are seen to be constantly strong and don't want to have the impression that we are fallible, that we can break, that we need to get fixed. There are parts that are worn out. There are parts that need to be bolstered, if you will. And when that scenario comes, and it will come to everyone, there isn't, Father Time is undefeated. When that odometer starts clicking and you start getting more mileage on you, things will happen. And when things happen, it's important not to be embarrassed about them, but to really seek out the help necessary to allow you to be the best version of you while you're here. And I tell men all the time that it is not an embarrassment for you to be here at the urologist, because especially when you're talking about erectile dysfunction or when you're talking about prostate, a lot of these men diseases are not really men disease. This is really a couple's disease, because when you're having challenges down there, these are challenges that don't just affect you, but it affects the person that's most important to you, which is your significant other. And if you can't interact with your significant other that way, then that's when things start to falter, and the household is not as tight as it used to be. And that's when things happen. And so that's where I come in to help you to be the best version of you while you're on this side of the dirt.
That's awesome. I have a question.
Go ahead.
So I'm sorry, I didn't mean to interrupt, but the couple of questions was coming in, and it's the question I have. It's twofold. So, doctor, as it refers to prostrate when you're doing your prostate exams, I'm curious as a female, and I had three people to ask the same question. Is it an age limit as it relates to getting prostrate? And where I'm going with this question is, with cancer with women, we have our mammograms. And typically they'll say something like, you have to wait till you're 40. I think, correct me if I'm wrong, Dr. Priscilla, but I think it's 40. I think it fluctuates with the age, but it's a requirement of an age for a female, right? And we were always told, because I remember this for myself, if you have a history of it in your family, then by all means tell your doctor. And that would hopefully give you a segue to get the exam right if you're before 40. So my question to you, when it relates to men and prostate cancer, is it an age limit if someone's 13 years old versus 25, feeling something down there, that type of thing? I'm just curious.
Perfect. So the beauty and the curse of living in the United States is that we have access to medical care, so much so that when men have issues and problems with prostate cancer, initially you have no symptoms whatsoever. So it is not like you're having some discomfort or pain or blood or something's not working right down there. It is a simple blood test that your primary care physician will get annually, that all of a sudden those numbers that were normal, which is the PSA, those numbers will start to spike and start to rise. And that's usually one of the first indications that tells your primary care physician that, hey, you need to go see a urologist, or the urologist saying, hey, we need to go ahead and entertain doing a prostate biopsy. And so it is so important, honestly, that I have to start convincing patients that, hey, yes, this PSA is elevated. And sometimes I may have to repeat it once or twice, not to convince me, but to convince the patient that this was not an aberration. This was not that, oh, I had a cold last week and that's why my PSA is high. That there really is a true reason why that PSA is high, and we need to proceed with a prostate biopsy. So doing a physical exam on a male, traditionally after age 40, is appropriate with a blood test and a physical exam every single year. If you have a primary degree relative, more than one, say for instance, your grandfather, your father, paternal uncle, and a Black male, it is important that they actually start at age 35. And so that's when we'll start that physical exam and PSAs, because you are in a different category than your traditional 40-year-old male, where you have a strong genetic link that we need to follow closely, or so that we can catch that problem and treat it accordingly.
That's great. Thank you. And three more questions came up. I'm not putting them up, Dr. Purcell and Dr. P, because it's just, they're redundant. But the question, I'm trying to quantify them. Doc, the question is, in terms of on your side of the house with the males versus outside of the house with the females, people are asking, does it seem to be education is the key, perhaps, or could be the solution to helping men? And what can women do,
Of course,
that are partners to help men?
of course, you'd be surprised how many times it is the wives that are bringing in their husbands. Because there are these guys under no circumstance whatsoever, because they feel if they get a finger exam, all of a sudden it's going to flip some switch and they going to go a direction that they ain't want to go. But I promise you, I have never, and I stress the word never, had a patient who had one physical exam by me and then left his wife for somebody else. Promise you. So up until that happens, I think you are safe getting a physical exam. But you'd be surprised that our women, of course, know the importance of getting an annual mammogram, know the importance of getting an annual pap smear. So they're used to that yearly annual exam. And it really takes someone who's in touch with that to reach out to their counterpart and say, honey, I need for you to head on into the doctors, because this is important, because while you are here healthy, you help this household. If you are ill, if you have an issue or a problem, then that's when it puts this household in jeopardy. So it's really all about that investment of making sure that you get your husband or your boyfriend or your significant other in to see the urologist to make sure that he's taken care of. The same way, like here in Georgia, we get an annual car needs to be you have to do your car inspections once a year. And so if you take your car in every year to get your emissions testing and inspections, how's your body any less than that? So it's
That's right.
very important for you to make sure that you do your annual exam so you can take care of yourself.
And I would say do it more sooner than later. Don't wait till you almost at death's door. Then you, Dr. Alphonse, then you have to make some decisions you might not really want to make, but you at a place where that person has come in, they are in dire need, and you have to make the decision of, well, okay, this is where we are, this is where we located, and this is decisions that needs to be made. And then,
Agreed.
and that's why, I hope men who are on or listening to understand it's okay. All is not lost. There is hope. Don't wait until the last minute. Then you're asking to Dr. person like Dr. Alphonse to work his magic to make things work. But yeah, definitely like you said, if you're having issues with your libido and things are going on, I'd rather see you now than later. And again, I like the part about if you have to have that exam, like you said, the switch is not going to flip and you going somewhere else. No, I'd rather go, as they say, cough. If I was a man, cough, get it over with, and be healthy, than not be able to cough, and then you got to make a decision of like, sir, this is where we're located.
Agreed. Especially not every male who has an elevated PSA. PSA is called the prostate specific antigen. It's the blood test that triggers the conversation of us needing to do a prostate biopsy. But not every man who has an elevated PSA has prostate cancer. So if your primary care physician does your PSA value and it comes back elevated, and you're like, oh, I ain't going to the doctor because if I go there, they just gonna find something. No, if the PSA is elevated, it can mean a prostate infection. It can mean prostate enlargement. It can mean a precancerous prostate tissue. It can mean prostate cancer. And so there's lots of different things that we can find that the elevated PSA does not just give you a death sentence that you have prostate cancer. But if you are that 39% a patient who has a prostate biopsy and it comes back positive with prostate cancer, if we catch it early, we can knock it out. And it's all about catching it early, because once you catch it early, then all of the options available to you, whether it's robotic prostatectomy, whether it's radiation seed implantation, whether it's cryoablation, IMRT, HDR, all these other different ways for us to be able to treat prostate cancer, there are lots of ways to treat it. But if we catch the prostate cancer when the cat's already out of the bag, then it really limits the therapy options that we're able to give you, because the curative options are off the table. And now we're more in a defensive mode where we're just trying to do as much as we can to kind of keep you alive rather than being able to do a curative mechanism.
That's good. So
That is
thank you so much for bringing it up, because Dr. Fonts, I know we're talking about the male. I know sometimes the male or the female can get this as well, a UTI. What are the symptoms of that someone needs to come to see you? And I've heard too, the second part of the question is cranberry juice a good drink to utilize when you have a UTI?
Perfect. So don't let me forget the cranberry juice, and I'm going to come back to that. So urinary tract infection. Urinary tract infection is something that is obviously quite common in women. And for the most part, simply because of women's anatomy, it is not unusual for a woman to have a urinary tract infection maybe once, maybe twice within a 12-month calendar year. You see your primary care physician, it's treated, over and done with. If a female has more than 3 urinary tract infections in a 12-month calendar year, that is deemed recurrent urinary tract infection. That's what's appropriate. That is what it's appropriate for you to see a urologist. That's when we do our evaluation, where we do a CT scan looking for kidney stones. We do an appropriate camera where we look inside the bladder. We do an appropriate physical exam to make sure that the bladder is lifted up appropriately and that it has not anatomically moved out of position, because these are all different reasons why a female could have a recurrent urinary tract infection. In a older female, one who is, let's just say, past age 40 or into their 50s, anatomical issues such as the bladder possibly being out of position is a common reason of why a urinary tract infection can occur. And it's important for us to identify that so we can talk about ways of lifting the bladder back into its normal position. Once you put it back into its normal position, the bladder is able to empty better. Then recurrent urinary tract infections are not as common in women who are past age 40. Now, in your younger females who come in with recurrent urinary tract infections, that tends to be associated due to recurrent intercourse. And let's just say recurrent intercourse can introduce bacteria in a young female. And that is a reason for, if we find out there isn't anything else going on, and that's the true reason for recurrent urinary tract infections, there are antibiotics that we can give you an hour before anticipated intercourse, or an antibiotic that you can take immediately after intercourse to help reduce the bacterial load and can reduce recurrent urinary tract infections. So that's in the female. Now in the men, the anatomy is completely different, where of course, because of the penis, the likelihood of bacteria being able to crawl inside the bladder in a male is much more difficult. And so if a male has one urinary tract infection, that's appropriate for that man to see a urologist to figure out what's going on, because it is not anatomically normal for a man to have a urinary tract infection. So regardless of the age, if a male has a urinary tract infection, it is appropriate for them to see a urologist to start looking for things such as stones, to start looking in the bladder, to see if there's a bladder stone, bladder mass, to see if the prostate is too large that is preventing you from being able to empty properly. So these are kind of all the different algorithms that we go through to see what's going on, especially when we're talking about UTIs.
So what is that? So I know the second part of the question was about cranberry juice. Is that something good to drink daily, or for someone who might be having a UTI?
Perfect. So thank you for reminding me. I knew I was going to forget. That's why I asked you to remind me. So cranberry juice is a very good, I don't want to use the word repellent, but it definitely can minimize a urinary tract infection. So what it does is it actually changes and alters the pH down in the vaginal area. That makes it less hospitable for a bacteria to be able to kind of set up shop inside the vaginal area, or to introduce itself inside the urine channel, which is called the urethra, to get inside the bladder. So the cranberry juice, it doesn't have an antibiotic, but it changes the pH to prevent the bacteria to be able to kind of crawl inside the bladder in a female to cause these UTIs. So in women who have repetitive UTIs or who are prone to get an infection, taking cranberry pills or drinking cranberry juice for people who have prone to infection can be very, very helpful.
That's good to know that, because, and another thing, I had a family member that had a UTI, didn't tell us to the last moment, and think the bacteria from that got into the system and caused them to become very ill and badly dehydrated. Is that something that definitely can happen if unlooked upon?
Yes. So one of the things, and I still remember a young female who came in who was having recurrent urinary tract infections and just thought it was due to intercourse, saw their primary care physician. The primary care physician saw the patient, put her on antibiotics, gave her antibiotics. The antibiotics repetitively were taken, and then the patient got the antibiotic and it stopped working. So then they came in to the emergency room with chills. We did a CT scan and saw that she had a very, very large stone, roughly half the size of the fist, in their
Mm-hmm.
kidney. And that stone was acting like a sponge for infection, causing repetitive infections in the kidney. And
Mm.
that infection backed up into her bloodstream. And she was called what we call septic, was in the ICU, had to place a tube in her kidney to drain all that infection in the kidney. And so these infections can be life threatening in the wrong scenario. And so it's very important if you are getting 3 or more urinary tract infections within a calendar year, that's when you prompt to start looking for a specialist or ask your primary care physician to send you to a specialist because something ain't right.
Yeah, and yeah, because when I had the individual, I was like, "Well, why did you know?" Well, you didn't, we just didn't want you to worry. I'm like, "But this has caused you to be in the ER
Correct.
because you have an infection. The bacteria has got into your system."
Correct.
And so, situation like so, I just really want to know if it can, if untouched about if it can happen. So that is definitely good to know about that. Now, my other question. Let me switch gears for
Mm-hmm.
the male. What if a male, married, however, and they got two, three, four, five kids, however, do you do that lovely procedure to if that male come to you and say, Dr. Alphonse, I need you to shut it down. What type of procedure or recommendations do you give to that person, that male?
So first things first, you got options. You could either get another job to pay for all them kids, or you can shut down the factory to minimize your expenses, right? So yeah, we're gonna do some financing consultation here, right? But in all seriousness, clearly we have the luxury in the United States of having a lot of the financial means that are available to us. But the family structure, for the most part, in the United States is really kind of two, maybe three kids. Once you start getting past that two and three and getting into the four, and it can obviously be quite expensive. And not to mention, it can get very uh, challenging to have one in elementary, one in middle school, one in high school, and one in college. So, birth control is something that is easy to be done on both the female side or on the male side. Now, on the female side, birth control traditionally can either be done with pills or injections and things of that nature to minimize, if you will, the ability for her to get pregnant. Or there is an outpatient procedure called a tubal ligation where they put a little camera inside the stomach and they can kind of clip the fallopian tubes to render you infertile and minimize the likelihood of her getting pregnant. But that causes an additional procedure to be done. That's an operative procedure where you got to be knocked out to have that done. On the male side, there are essentially a number of ways. Condoms obviously is one way to do it, but in the sanctity of marriage, condoms obviously is not a common thing that's done. So having a vasectomy is a very reasonable way of shutting down the factory, minimizing any chance of getting pregnant. Now, one of the problems of getting people in to having vasectomy done is there's this perception that if you have a vasectomy, that it literally shuts down the factory to the point where your penis is not going to be able to get erect anymore and erectile dysfunction is going to occur. And I can tell patients undoubtedly that a vasectomy does not cause you to have erectile dysfunction. In fact, in fact, I'm going to say the opposite, where if you are one of these lovely couples that goodness gracious, every single time you guys get together and you have sex, are you thinking in the back of your mind, oof, is this time when she's going to get pregnant? So you're always having buyer's remorse after intercourse. That's really not a way to live your life, wondering over your shoulder whether or not she's going to get pregnant again. So to be able to have the luxury of interacting with your wife, and not be concerned about the possibility of getting pregnant just opens, if you will, a whole level to intimacy where you can truly enjoy the company of you guys together and not worry about that other aspect. Doing a vasectomy is a very simple, straightforward outpatient procedure where we get you into the office, we can numb you up with some medicine down in the scrotal area, and we can do a very simple procedure where it does connect, if you will, the vas deferens, which is the tube that connects the sperm to the outside world, and you will be rendered sterile. However, I tell patients that if you get a vasectomy, immediately after the vasectomy, you still can get someone pregnant. And I tell people it is the equivalent of having a handgun, removing the handgun, but still having a bullet in the chamber. So
Wow.
immediately after the vasectomy, we have to have you flush the proverbial pipes a few times to ensure all the residual sperm that's downstream from where we did the vasectomy, all that stuff is flushed out to ensure that you do not have any live sperm in your urinary channel. So
Mm.
after the vasectomy is done, we have a patient give us a sperm sample. Usually it is 3 months from the date of your vasectomy because the life cycle of sperm is 72 days. So 72 days is roughly 2 months, 2 weeks. So we just round it off and just say 3 months. And so 3 months from the date of your vasectomy, we have you come in to give a semen analysis. We're not looking for the difference between live sperm and dead sperm. We want to see no sperm. So between when we do your vasectomy and that 3 month mark, we want you to ejaculate anywhere between 3 to 5 times to flush those pipes to ensure everything is negative. And by the time we see you for that 3 month mark, 9 times out of 10, all is clear.
Wow. Wow.
So this is, listen, I'm going to take a what I call a peel of layers back on the onion. Dr. Alpaul, if I could share my drink with you, which is ginger tea, I would say, please take a sip. That is so, it's so not overwhelming. It is so, I love them. I love them. I'm going to keep them, Dr. Priscilla. Is that okay with you?
No, you can't keep him. You have to give him back.
On a very serious note, I'm slowing down, and this is not hard for me to do, Dr. Paul. I am overwhelmingly so happy. Thank you for the detail caring that you put into explaining that, because am I smarter in the fifth grade? I think I am tonight, Dr. Priscilla. And I appreciate that. I just want you to take a minute and reprieve, because I have like 7 questions. They're all the same. And I'm going to kind of context and shape this. There's a
Sure.
lot of people out there doing hand claps, Dr. Paul. Some people don't want to come on and ask their question, which is fine. So I'm going to take the lead right now. And what I want to say, Dr. Paul, thank you.
You're welcome.
A lot of people are asking a general question. It's twofold. I have one of them. How are we looking as far as statistically for the blacks in our community? And what can we do now that tonight is the beginning of a new day for someone? Be better educated, where we can educate ourselves or come to be educated so we can spread this news. This is wonderful information. But the
Sure.
first question, stats, as far as statistically, are we higher number than our Caucasian, other ethnicity groups? And why do you think that is? I know why it is, Dr. Fonzo, but
Sure.
tell me why it is.
So I am going to agree with you. I think that the power in sharing knowledge and wisdom, we have really made some significant inroads into spreading the message that getting your male well exams on an annual basis is okay. It doesn't make you change into a different sexual preference. It doesn't change who you are as a man. And it is actually the right thing to do. And so, as we are starting to educate and through radio programs and the churches and the health fairs and all these different communities and the sororities and universities, we have really empowered ourselves to really spread that message. And we have done a really good job. I think that as we are learning the things that we need to do as men to keep ourselves fit for our families and fit for ourselves, that message is getting out there. And as each one teaches one, they realize that they are doing things that are mandatory to allow them to be the best versions for themselves. So as long as we can keep preaching to men, hey, if you're hurting, go see your doc. Hey, if you got a headache and it doesn't go away with the over-the-counter medicines, go see your doc. If you are having a belly ache and start having a lot of issues that doesn't go away over days and weeks, go see your doctor. We do a really, really good job of going to work every day, but we do a really good job as well of paying our insurance and never using it. Blue Cross Blue Shield loves people like y'all who work every single day and just giving them that money, and never use it. So if you're going to work so hard, at least recoup all that investment that you're giving away every single month for insurance and take care of your body just as well.
Doctor, I'm going to interject because you just hit a very soft spot for me, and I'm going to repeat it because it's my show, right, Dr. Priscilla, and I can do what I want.
This
And
is
I'm
yours.
telling you, I live by what you just said, and I'm going to hone back on the part about you have medical insurance for some people have who don't have it. I'm speaking to the people who have health insurance because let's be clear, Bella's about to go there. The activism is coming out of me, Dr. Priscilla. I can feel it. For the people who have insurance, let's be clear, everybody doesn't have it.
Yeah.
Even with the Obamacare, I'm going to slow down because I'm going to take 5 minutes and I'm going to give 5 minutes back to Dr. Paul. Listen to me, family, and I mean listen to me. My family who have medical and health insurance, I applaud you. Dr. Paul is saying, you got it, use it.
Use it.
Do not be in the fold, because I'm certainly not in the fold, to pay this money, hard earned money, I
That's
know,
right.
and not utilize the service. And I'm saying it slowly because Dr. Paul doesn't know. We just met in the backstage. But what I pride myself on for over 30 years and working in corporate America and for myself, I always manage to make sure I pay into my health insurance and I use it. To the point, God rest my mother who's gone on, she had breast cancer and she will always get on me. I said, honey, mommy, love you. I'm going to always go to the doctor.
Yeah.
Sniffle, cold, sneeze, whatever. My family used to make fun of me. It didn't matter because I knew I had health insurance and I was okay in my mind, doctor. No, I'm okay.
Mm-hmm.
So I'm one of those who I'm going to use it and everybody's going to know me, Dr. Paul. Am I not right, Dr. Priscilla? Everybody
Very
knows who
true.
Bella
Very
is
true. Very
because
true.
I make myself known. So I'm being serious, family. I cannot stress this enough. Dr. Paul took out his time out of his con schedule, thanks to Dr. Priscilla, to come on this show. Didn't have to. I'm going there. I'm preaching to the choir now to give us valuable information, which is invaluable price wise. We cannot pay him enough. And as he said earlier, I want to keep Dr. Paul in the clear because Bella's making a lot of changes to protect everyone. Everything that he is speaking with people is from his own personal experience. He's not representing Wellstar tonight. So, family, for the replays, because I know everyone's not going to see it tonight, for the replays, please rewind this very sacred video. Rewind it from the beginning and listen to it over and over and over again. I'm talking to my ladies. Where are my ladies in the house? And for those who have significant others, tell them. You know what you need to do and do it.
That's true.
We've still got some time left in this programming. I'm going to toss the ball back to Dr. Priscilla. I'm going to let her close out. But listen to me, family. Listen to me. Education is the key. Y'all know half of my story. I'm gonna tell you the notes, but I'm telling you right now, as God is my witness, I said it as God is my witness.
Mm-hmm.
Faith without the working part, come on, y'all,
Oh, it's true.
is DEAD.
Okay.
Dr. Paul Alfonso, I'm sure, and I am not making any slack. The spirit is on me, so I'm going to take a minute or two. And although Dr. Paul is a medical doctor, and we all know we are big boys and girls in this club tonight, you all know doctors go a long time, many, many valuable years to hone their craft and to get out and serve the people. Come on now. Spirits
It's
on me.
true.
This is unscripted. That's why it's called Bella Unplug, y'all. Y'all feeling me? We don't
Mm-hmm.
come on here and script. We come on here, not just emotion,
Right.
directed intentional emotion to the Holy Spirit. Y'all with me on that?
That's right.
Preach, preach.
So it's on me now. And I'm always about my father's business. But Bella Biz is about the business.
Mm.
And I'm feeling right now that somebody needs to hear what I'm saying. And I'm talking to my brothers. I had keyword HAD, 5 brothers.
Wow.
I now have one. And if you're out there, Brother Cornell, shout out and be more. That's where I'm from, Dr. Paul. And I'm getting serious now. And I have witnessed a lot of my brothers, I'm talking about my blood brothers who have gone on and their ancestors now, not go to the doctors. And I'm going off script because I can do this for this silly myth in our black community. I don't go to the doctor. Yes, you can go to the doctor, man. I'm talking to my man. I'm talking to my brothers. Where y'all at? It ain't nothing unmanly about going to the doctor. As a matter of fact, the spirit is so on me. It is manly to go to the doctors. Because as Dr. Paul said, for those men who are the real breadwinners, and y'all know what I'm talking about, that's another episode for another time.
Mm-hmm.
We women, we need you to continue to survive and continue to be the breadwinners. So we need you to get off your ducks. You can go everywhere else. Come on now. I'm
That's right.
talking to somebody
Preach,
That's right.
and
preach,
go to
preach.
the doctors.
Heck, let them know.
So as I take the last 6 minutes, and y'all know I'm a very prompt person, I'm not playing. I've never been playing. This is over 150 episodes. Y'all know some of my story. But this is the most significant because 4 of my brothers are gone. And I'm gonna tell y'all right now, I can say it as a direct cause of not going to the doctors,
Mm.
continuously taking that pain because I know the type of household I grew up in, the man household. My own father, God bless his soul, died of congestive heart failure, Dr. Paul, refused to go for years. So I know what I'm talking
Wow,
about.
wow,
Mm.
wow, wow.
So, brothers, this show really was for you.
That's right.
So as I toss the baton back over to Dr. Priscilla, just know Bella ain't playing, but I'm going to tell y'all, look at this video over and over and over again. And as y'all know I like to do, as I'm coming out my spirit, I'm going to ask Dr. Paul and put him on blast. Will you come back, Dr. Paul, and do it again, again, again through Dr. Priscilla? Because Dr. Priscilla know I got no problem in begging because I want our community to know what's going on. And
I
we got to
got
do it over and over and over and over again till we get it right. Will you come
That's right.
back, Dr. Paul?
you. Repetition is the key.
That's right.
I love you, my doctor. All right, take it away, Dr. Priscilla. We'll go ahead and close us out and tell us what's on your heart.
Well, I would just say, Dr. Alphonse, you have given the audience a wealth of information. You have given information to men that are listening tonight, especially those who've been hesitant about going to the doctor. You need to see someone like Dr. Paul Alphonse, or even see Dr. Alphonse if you're here in the Atlanta area. Your health is more important. You can make all the money in the world, but if you're not healthy enough to spend it, what's the point? What is the point of having the money if you're not wealthy and healthy enough to spend it? So my thing is move away the isms and the stigmatization of, oh, if I go to the doctor, I don't want him to do this. Like he said earlier, it might flip my script. No, I'd rather you flip the script and you tell me that I need something done to me than flip the script to tell me I need to call the nearest funeral home to flip the script the page to start preparing. your last rites. It's so important. If you have insurance, use it. Your health is very valuable. People like Dr. Paul Alphonse, they're here too, and they have worked their craft to make sure we stay healthy, especially us in the African American community. I oversee almost 3,000 African American physicians here in Atlanta. I'm very honored and proud to be able to say I work for this organization that Dr. Paul Alphonse is a member of. I am truly honored to say if I need anything, I can call this any physician in this organization. They have been there for me, for myself personally, my family. I am truly honored. No, a lot of people might not have this jewels that I have, but I'm just saying, you have a jewel called insurance. Use it. You can pay now, or you can pay other funeral homes later. So your selection is sit there and pay, and then you go out of here, and then your loved ones are making arrangements for you because you neglect to take that one moment to make that phone call to call Dr. Alphonse's office to say, look, speak to Mimi, make that appointment. That's your own fault. You can't blame nobody but your own self. Your wife been hitting you over the head. She been almost dragging you to the doctor. Your significant other, you wonder why things not right because you need to see somebody like Dr. Alphonse. That's what he does. He does his craft well. I am a witness. I know that from people in my family, he does it well. So I'm excited about what he has brought to us today. This opportunity that we have is someone in our African American community that cares about us and our well-being. And I'm very excited. And thank you again, Dr. Funk. You could have been anywhere else tonight on a Friday night, but I thank you for taking time out of your busy schedule to be with us tonight, to actually drop these golden nuggets. Hoping males and females have heard what you have said tonight. And I'm going to toss this over to you to close us out with some golden nuggets to help us along our path toward being healthy.
Okay, thank you. And Bella, goodness, you my new bestie now. All right, it's always been Priscilla, but me and you, we good, right? Me and you. What I do as a urologist is not easy. It is dealing with some very intimate and very personal issues, but yet at the same time, not to redraft everything that we said. You do not get any extra credit from the insurance company if you don't use it. They don't give you your money back if you don't use it. And so take care of yourself, take care of your family, do what is necessary to keep yourself on this side of the dirt as long as possible. Work with your primary care physician, ask for the referrals to a specialist if you are having issues within the urological realm. We can get it taken care of. If we can get to it early, we can take care of it. If we get to it later, we have less options of how we can take care of things. So let us do what we can to make sure that we allow you to be the best version of yourself. And so with that, even my small kids, age 13 and 15, they see me doing health fairs and they see me doing this radio show and they see me doing a whole bunch of things and stuff like that. So they understand that it's normal to see a physician. Their friends know that it's normal to see a physician. And so this is how we do it, by each one teaching one, letting them know that it is okay to see the doctors. It is okay to say that something doesn't feel right. It is okay to say, I need help. And once you get that help, we can take care of you.
That's right, because just because someone says you have cancer, it's not a death sentence anymore. Technology and research has been profound that people are living longer. But again, I say, like you said earlier, come see me now, then later come now where you have the options. Then later your options might be slim. Take care of yourself. This is the best conversation I can take. Your health is most important. It's more valuable than any money in the bank to you. Definitely, without a doubt. Again, I want to say, Dr. Alphonse, thank you so much from the bottom of my heart being here this evening. I greatly appreciate it, and more than words can even say. Thank you, Bella, for allowing me this opportunity to be with you this evening. And then those who are listening, please join me on Fridays. If Bella, if you don't mind me saying, I have my own segment now on KC Prize, the number 1 business rated show here. I'm on every Friday with Real Talk with Dr. P. If you're excited about this show tonight, please, if you want to be a guest on the show, Miss Bella is going to be on my show. Dr. Alphonse, I know you're going to be on my show. Please, we're there to give you real-time conversation about health, wellness, relationships, marriage. And then I also have a segment called Boss Ladies. Women who are making boss moves, who are in their personal lives making boss moves as well as their professional lives, because boss stands for bold, optimistic, successful, and you are succeeding in your craft. So please join me on that particular show every Friday or every week on 1160 AM radio and iHeartRadio. We're here to assist you and be a part of your lives. And again, I say thank you so much again, Bella. Thank you, audience, for listening to us tonight. Again, hope all what we have said this evening, you take it to heart. Most of all, use it, share it, and tell your friends your health is better than any money you have ever in the bank. And I'll turn it over to you, Bella.
Oh, that's some good stuff right there. So Bella, get ready to close out. And y'all gonna have to keep me on good behavior, family, because I'm getting ready to show out again in front of Dr. Paul. So Dr. Paul, we gotta take one more licking. So family, here I go. Here I go with my begging. Now y'all know I'm self-funded, right? So here we go. I don't have that little ticker. It's called a ticker, y'all. Okay, let's get with the program. That ticker says, thank you for the donations. But guess what, y'all? I ain't getting none. Mm-hmm. Do it did said it because I've been told by Ambassador Andrew Young and so many others, a closed mouth doesn't get fed. Okay. And my queen sister over here, I'm going to shout out to some individual people sold into me because you know what? We real over here, y'all. We sisters. We real sisters and we are family. So guess
Right.
what, y'all? Help Bella out. Do I need the bag? I don't think so. But what I do need to let you all know, if you want to continue to get excellent programming, I am self-funded. And I think y'all know what that means. I quit that good government job 2 years. It's coming, that episode as to why I'm where I'm at today. But in the meanwhile, I need y'all help because I take every one of my own pennies and dimes to make sure this programming gets funded. And I like to say, I think it's excellent programming because I
Yes, it
don't
is.
have just anybody. I have excellent people who are subject matter experts who are either community leaders, political officials, medical doctors, and then on and on and on and on. Yes, I'm bragging because I can. They come on the kindness of their heart. 9 times out of 10 out of a PSA, that means their own time on their own dime. There's never no money exchange. They come on, you know why? Because they care about the community. So come on, y'all. I'm trying to get back on my good behavior. Help Bella out. And when I say help me out, let's not get the church thing going on, okay? Because you better believe every daggone penny will be accounted for and it'll go right back into this programming because after all our own Bella Biz and come rain come shine it will continue on if you donate or if you're not because this is God's platform not mine. Can y'all
Amen.
dig it?
Amen.
So
We can
stay
dig it.
tuned. I'll be on Monday at 7 p.m. Entrepreneurship 2022. I have some absolutely phenomenal entrepreneurs who are out here grinding every day, y'all. Yeah. Just like Dr. Paul, just like Dr. Priscilla. I want to thank you all from the bottom of my heart. I'm getting ready to close out, but I want to thank you all. Dr. Paul, you are coming back. You are the highlight. Outside of Dr. Toko, nobody beats Dr. Toko, right, Dr. Priscilla?
I
I'll
love
let
Mike.
you
Mike's
know
a great guy. I love Michael. Michael's a great guy.
Michael's
But how
excellent.
no, but however, Dr. Paul, I can put you right beside him. Okay, I can handle
That's
both of
great
y'all.
company. That's great company. I'll take that.
Well, I thank you. We've had fun. We've been very informative. I love you all. Until we meet on Monday at 7 p.m. Entrepreneurships 2022. Good evening and have a great weekend, everybody.